In this morning's Money Watch, saving on your medical bills. A typical American household pays an average of $18,000 a year for health care. And with a number that high, we thought the least we could do is get you some advice on how to negotiate your medical fees and possibly save thousands. CBS News business and economics correspondent Rebecca Jarvis is with us this morning to help us do that. That number is huge. I mean, when you hear it, it just looms so large. Before, though, we can even look at reducing it, we have to understand and know what we're paying for. And you say it's really important to make sure that we're paying for the actual cost of the services. How do you do that?
Well, one thing that's important to know is to just know the cost of the service. And believe it or not, there can be huge disparities in cost for the exact same thing. So, for example, an ankle x-ray could cost you in the city of New York as much as $2,500, or it could cost you as little as $140. That's more than $2,000 in differentiation. Well, how do you find out those numbers? NewChoiceHealth.com is a wonderful website where you can go, you type in your location, you look for the type of service that you're looking for, and it will spit back those numbers, the high and the low end, and then it'll give you a list of providers in your area and what they specifically are charging. So you can say, all right, if I'm going for a routine procedure, like an x-ray, for example, where could I get it at the least expensive amount? The one thing to consider here, however, is that in many cases, you're paying for a doctor, you're paying for their training, you're paying for their location, and you're also paying for whether or not they've been sued before. So sometimes these prices can equate to service and whether or not you're getting the best.
Okay, but it can still help you do that research and find the best cost. Okay, so that's step one, knowing what you should pay and what you are actually paying. Step two, when you look at certain things, even if you could shop around, for something like surgery, it doesn't seem that you could actually cut corners, but there are ways to save on surgery too.
Well, and again, you want to ask your doctor about this. So there's outpatient and then there's in-hospital surgery. And if you're in the hospital and you have to spend a night, you might end up paying as much as $5,000 more for your surgery just because you've spent the night in the hospital. So what you want to do is ask your doctor, could I go outpatient? Would that make sense? Could I save some money here? And if they think so, great, do it.
When you do have to pay that medical bill, how important is the method of payment?
It's very important. And if you pay by credit card, you're more likely to not have the opportunity to negotiate on the back end. So think about potentially paying in cash, looking for a payment plan so that you can pay it out over time. And also with credit cards, you might make interest. You might end up having to pay more interest, making the cost of the medical bill much higher over time.
Great tips as always. Rebecca Jarvis, thanks.